Hello, everybody. Welcome to Pittsburgh Medicare 101. How is everybody doing today? Good, I hope. Just if you could type your name down in the chat bar there and say hi and see that you're here. So I see Dave. Hi, Dave. How are you doing today? Hi, Libby. How are you? Good. Glad to have you here today. Uh, is that Mary? Hi, Mary. How are you? Myron, thanks for joining us today. Um, Hey, thanks so much for coming. I mean, we're kind of living in strange times here. We're used to going out and doing these in libraries locally. We get to see your smiling faces and joke and have fun with you. But for right now, this is how we get to do it. We know that a lot of you need to know about Medicare. You have questions, you have decisions coming up, and you may not have a lot of time to do that. So we're forging ahead with these virtual webinars. So welcome. And I know a couple more people are joining us, but I do not want to delay the start of the webinar for the people that are here on time and early, because I mean, we have one of those unusual things here in Pittsburgh. We have sunshine outside. I hear that the temperature is nicer than it was last night, and we know rain's coming back tomorrow. So I want you to learn what you need to about Medicare right now, and then be able to get outside and enjoy some of that sunshine, which we have nowhere near enough. So again, if you're checking in late, just type your name, say hi, so that we know you're here. But I'm going to switch now, so give me a couple seconds so I can switch over to our presentation. Okay, so can everybody see our first screen there? Just go ahead and type yes, or that you can see it over there in the bar. Okay, so again, welcome to our Medicare workshop, Pittsburgh Medicare 101, Medicare Made Simple. And I do want to let you know this is an educational workshop. We're going to be going over Medicare today. We're not going to be trying to sell you anything. So go ahead and just try to soak in as much as you can, learn what you need to. And we are going to have a dedicated question and answer session at the end. So if you have something that you need to know, want to know more about, just write your question down, and then we'll give you an opportunity to ask those and have them answered right at the very end. So I just want to make sure that you all know that you're in the right place. These are the things that we plan on covering today, so that you know that you get the right answers. We're going to go over original Medicare Parts A and B. We're going to go over Medicare Part C, which is the Advantage plans. We're going to go over Medicare Part D, which is the prescription drug coverage, and supplements, Medigap plans, how to have something that fills in what Medicare does not pay. And probably the most important thing, we're going to go over how to get help when you need it. So who here feels like there's a lot of confusing words out there? It's just a whole big jumble of everything with Medicare. I know as somebody coming up on age 65, you're probably getting a ton of mail. Who's getting a lot of mail? I mean, when we meet with people in person, when we talk to people at the libraries in the area, you know, they're telling us the stack of mail could reach to the top of their kitchen table. Getting a lot of phone calls. We've had one person that one lady started tracking in January, and from January through the early part of March, when we had our last workshop in person, she had 350 phone calls. So it's overwhelming. So that's exactly why we're conducting these educational workshops, to try to get you some clear answers and a clear path to go. Now, I need to get this disclaimer out of the way right from the start. And again, I'm going to emphasize this is for educational purposes only. We're not going to be discussing any specific insurance company details or benefits. In fact, we're not allowed to. So myself, Bill Cardos, and my team here at Pittsburgh Medicare 101, we are not connected with or endorsed by the U.S. government or the federal Medicare program. But that being said, what we are is insurance and financial advisors combined. We have more than 100 years of experience right here in the Pittsburgh market, and we've seen all kinds of decisions, the good, the bad, the ugly, and that's kind of why we started doing these, because we saw so many decisions that affected the whole balance of people's retirement that we had to provide some help. So hopefully at the end of the day, we'll have directed you away from the bad and the ugly and put your feet on the path towards the good. So who here has received this book already? Okay, so it's Medicare and You 2020. It's a huge book that the government sends you anywhere from 4 months before you turn 65 to 2 or 3 months after you turn 65. It's packed full of information. Everything you want to or need to know about Medicare is in that book, but it is 128 pages. It is written by somebody that's employed by the federal government, so it may not be the easiest thing to understand. So that's, again, we're going to distill this down for you. So not going to spend a lot of time here, but this is what the Medicare card looks like. It's going to have your name on it. It's going to have a Medicare number, which is nothing like your Social Security number or any other identifying number, and it's going to have when your Medicare A and B starts. It no longer has a signature, your Social Security, or your gender on there. All those things made it a very good tool for identity theft, which we don't want to have happening. So who here feels like this guy? Just say yes if you do. You're trapped right in front of the Medicare maze. You know there's an end somewhere off in the distance. Twists and turns might be confusing. Well, again, so just to reconfirm, we're going to talk about Medicare Parts A and B today. We're going to talk about the Advantage plans, Medicare Part C, the drug plans Part D, and Medigap. Some of those things that will, again, fill in the gaps that Medicare doesn't pay for. So first off, what exactly is Medicare? So Medicare is health insurance for these three groups of people. If you're 65 and older, if you're under 65 and been on Social Security disability for 24 months, Lou Gehrig's, you don't have to wait, you get it right away. And also if you have end-stage renal disease of any age, you get Medicare right away. It's run under very strict guidelines from the Centers for Medicare and Medicaid Services. In order to get Medicare A and B or B, you do have to be a U.S. citizen or lawfully present in the United States. Sometimes Medicare is confused with Medicaid, but they are two different things. So basically, Medicare is an entitlement and health insurance program for those three groups of people we just talked about, where on the other hand, Medicaid is a joint federal and state program that pays for medical costs for those people that have limited income and resources. And somebody who qualifies for both is called a dual eligible person. So what's original Medicare? So all the parts that there is to original Medicare is Part A, which is basically the things that happen in a hospital, and Medicare Part B, which is the providers providing all the medical services. So this is all there is to original Medicare. Now, the important thing to remember with Medicare Part A and B, if that's all you have, it's not going to cover 100% of your expenses for health care. So again, a little bit later on in this workshop, we're going to go over some of the ways to have those things that Medicare doesn't pay for be taken care of for you. So Medicare Part A, it's our hospital insurance. And in order to get Part A, here's what has to happen. You must have worked for a minimum of 10 years or 40 quarters and paid FICA tax during the time that you worked. And you'll get Medicare Part A for free. You'll get it at age 65 for most people, but if you have some of those conditions, you can have it prior to 65. Now, if you did not work 10 years or 40 quarters, but your spouse did, you're still going to get and be entitled to Medicare Part A at no additional expense. However, if you didn't work the 40 quarters, you can purchase Part A, and how much you pay for it will be determined by Medicare. Okay, and again, in order to get Part A, you do have to be a U.S. citizen or lawfully present in the United States. So what does Medicare Part A cover? Okay, so Medicare Part A covers a semi-private room. It covers hospital services and supplies, your general nursing care, meals, and all but the first 3 pints of blood. It covers inpatient mental health care up to 190 days lifetime, and it provides care in 90-day blocks. So what those 90-day blocks cover, if you have an illness and you are in the hospital 90 consecutive days, 90 days in a row, the Medicare is going to pay for those 90 days. If your stay extends past that, which it rarely does, most people don't know anybody that's been in the hospital 90 days in a row, Medicare gives you an additional 60 lifetime reserve days that you can use to have up to 150 days in a row in the hospital. Now, those reserve days, once you've used them up, they are gone. They never come back. But the 90-day blocks, they keep regenerating basically once each quarter. Now, there are some things that Medicare excludes. Now, right off the bat, Medicare does not pay for private duty nursing. They do not pay for comfort and convenience items. And unless you have a reason for needing a private room, a medically necessary reason, then it's not going to pay for a full private room. So earlier on, we said there are some things that Medicare doesn't pay for. These are the gaps. So day 1 through day 60 in the hospital, Medicare pays all but the first $1,408 of each hospital stay. Day 61 through day 90, Medicare pays all but the first $352 of each day. And then day 91 through day 150, Medicare pays all but the first $704. Now, with that $1,408 gap, day 1 through 60, if you're unlucky with when you need to go in the hospital, you could end up owing that up to 4 times a year, once in each quarter, if you do not have a continuous stay. Another gap in Medicare coverage is they will pay for all but the first 3 pints of blood, and they don't cover any hospital costs beyond 150 days in a row. If you need some skilled nursing care, and I do have to emphasize, it is only skilled care, not assisted living or anything below skilled, they pay 100% of day 0 through 20. Day 21 through day 100, Medicare pays all but the first $176 of each day for skilled nursing. Anything after 100 days in a row, you're responsible for, so you'd have to pay through your own assets, some kind of private long-term care insurance, and also if you needed, like again, in-home care, custodial care, that's not covered by Medicare as well. So let's jump into Medicare Part B now, the other original part of original Medicare. So for most people, how it worked in the past is the premium for your Part B came right from your Social Security check. But what we're seeing more and more now is people not taking Social Security at age 65. They're waiting till their full retirement age at age 66 or later. So for those people taking Medicare at age 65, you will be billed for your Part B premiums quarterly. They will send you that bill, and you'll have to determine how you're going to pay for it. So if you're on one of the Medicaid programs, you're one of those dual eligible people, the state will pay your Part B premium as long as you meet their income and asset guidelines. Enrolling in Part B at the right time is important. It's so important, we have 3 slides dedicated to it because first off, Medicare says Part B is optional, but here's the thing. If you don't enroll in it at the correct time for you, there is a penalty, and that premium penalty is 10% for each full 12 months where you should have had Medicare Part B but did not enroll. Here's the thing, that's a lifetime penalty. So, I mean, that's a pretty hefty penalty, and they do enforce it. Unfortunately, every now and again, we'll run into somebody at a workshop or that comes in and works with us that did not do what they were supposed to. Back in October, we had somebody that was unenrolled for 11 years when they should have been. So they had 110% penalty for life for both them and their wife for the Medicare Part B. We had somebody a couple months back, they had a federal retiree program that got expensive, but they had never taken their Part B. So they were 5 years past when they should have enrolled. So they have a 50% penalty for life. So it's important. There's no reason to ever have that penalty. Okay, so when should you enroll? Okay, so your initial enrollment period, it works around the month that you turn 65. So the earliest you should sign up is 3 months before the month you turn 65. The month you turn 65, you're also eligible, and for 3 months after. That's your initial enrollment period. Now, a question we always get is, well, I'm working still and I have coverage through my employer. Do I have to enroll in Medicare Part B? Well, as long as your coverage is valid, no, you do not. So what happens in your case, you don't have to worry about that initial enrollment period, but when you come off your employer coverage, you now have a special enrollment period, which lasts as long as the initial enrollment period, and you can come off that with no penalty, no loss of benefits. You just have to prove that you did have coverage through your employer when you do want to take your Medicare Part B. And we will get into how to provide that proof a little bit later on in the workshop. Now, if you missed your initial enrollment period, you missed your special enrollment period, then Medicare gives you one more chance each year to take that Part B benefit, and that's January 1st through March 31st of each year, but your coverage then will not start till July 1st. And normally, if you're signing up during that general enrollment period, you're going to be incurring a penalty. Once you've enrolled in Medicare Part B, there's an annual deductible in 2020. It's $198. So you have to pay the first $198 for your Part B services before Medicare kicks in and pays anything. And then after that point, Medicare pays 80% of your Part B to the providers, and you or whatever coverage you have is responsible for the remaining 20%. So again, when to enroll in Medicare, initial enrollment periods, the first time you can enroll, we strongly recommend that you do it 3 months before, because if you sign up the 3 months before you turn 65, your coverage will start the first day of the month you turn 65. If you wait till 65 or after, then when your coverage starts will be delayed, in some cases up to 4 months. And you may need that coverage as soon as you turn 65. So don't delay if you can help it. Now you can enroll in premium-free Part A any time after the initial enrollment period, but again, you can only enroll in Part B. And if you have a premium for Part A during those enrollment periods we talked about on the screen before. And again, if you don't enroll when the correct time is for you, you will have a lifetime penalty. And one last time, because it is important, if your birthday falls in the month of April, the earliest you can enroll is January 1st. The latest you can enroll is July 31st. And during that initial enrollment period, you can select any of the types of plans that are out there in the market in your area. So prescription drug coverage, this is where we get a lot of questions. There can be a lot of confusion. But once you turn 65 and go on Medicare, there is only going to be 2 ways to get prescription drugs at that point. And the first of those is, if you keep original Medicare, is through a standalone prescription drug plan. If you sign up with a private insurance company to provide your Medicare coverage, then they normally have prescription drugs included and rolled right into those plans. Those are the Medicare Advantage prescription drug plans. Those are the only 2 ways that you can get your prescription drugs once you turn 65 and go on Medicare. So who's eligible to get a Part D plan, Medicare prescription drug plan? So basically anybody who has Part A and or is enrolled in Part B. So that's pretty much everybody. But here's the thing. You can only get a plan that's available in the area where your permanent residence is. Okay, so right now in our area, we have 30 plans available for prescription drug coverage. So you have to buy one of those plans. But say you're one of these people that lives a couple months of the year outside of Pittsburgh, someplace where it's sunny and warm like Florida, Arizona, and you see a plan there that you like. Well, here's the thing. If that's not the place of your permanent residence, you cannot get one of those plans, even though it may work better for you. The people that are dual eligible, they can also choose to enroll. And here's the thing. You have to get your Part D coverage at the right time as well, because there is a premium penalty here as well. And it's actually worse than what the premium penalty is for the Part B. For this, it's 1% for each month that you should have been enrolled and weren't. And that's a lifetime penalty as well. Now, who doesn't need Part D coverage? If you have VA drug benefits, you're good. That counts as credible coverage. And also, if you have coverage through your employer plan, you don't have to worry about getting Part D until you leave your employer coverage. So these are how the standard Medicare Part D plans work in 2020. And this is all set up by Centers for Medicare and Medicaid Services, so the plans at least have to be this good. Now, the way the plans work for 2020, they're set up so that area in the orange is the deductible. And they say, Medicare says you're supposed to pay the first $435 of drug costs before Medicare coverage kicks in. Now, here's the thing. Most of the insurance companies in our area, they waive that $435 if you're taking tier 1 or 2 drugs. So you'll pay little or no expense for your tier 1 and 2 drugs with most of the plans that we have available. Now, once the cost of your drugs has surpassed $435, then you're in the initial coverage phase where you pay 25% of the cost of the drugs. The other 70% or 75% is covered by whichever prescription plan you have or Medicare Advantage plan you have, until the real cost of your drugs passes $4,020. Once the total cost of your medication has gone past $4,020, guess what? You're still paying 25% of the drug cost. They said they're getting rid of the donut hole in 2020. Well, it's still there. You're still just paying 25%. In the past, you would have had to pay more. The only thing that has changed in the donut hole is who pays the remaining 75%. So the way they have it set up now is the drug manufacturers have to discount their drug when you're in the donut hole by approximately 75%. So you're still going to be paying 25%. Once the full retail cost of your medication has reached $6,350, you're in what's called the catastrophic coverage phase. That's the brown area. And during that period of time till the end of the year, you're only going to pay approximately 5% of the cost of your prescriptions. We're going to move on there because I understand there's a lot in that one little section. But this is what most of the people came here for today is what should I do? What should I do with all these choices facing me? And this is where we see a fork in the road where you have two paths. And this is also the place where we see people make the most frequent errors. And we're going to jump into those things that we see all the time, the mistakes people make first before we go over the two options. The first is, say you might have been working for the same company 25, 30 years, and you had the same health insurance company that whole time, and it worked well for you. You were able to go to the doctor you want. You were able to have the treatment done that you needed and didn't really have any trouble with it. And you figured, well, the common sense thing is I'm going to look at that same insurance company's plans for when I turn 65. Now, here's where many people run into issues there. Is those plans that you had through the employer or the healthcare marketplace are pre-65 plans. They're designed for a whole different demographic of people. They're designed for families, young children, and people that are normally have a healthier working lifestyle. And if you just blindly pick one of those plans once you turn 65, you may have a totally different experience. The other thing that we see people make an error, and I don't see any Sallies on the workshop today, and if you're there, I'm sorry, I'm not picking on you in advance, but Sally's just the name we like to use. But say your friend Sally's a couple years older than you, and she's done this whole Medicare thing already, and she's done the research, and she tells you to go with her plan because it's worked really well for her. She said, just tells you it's really the best thing since sliced bread, and you just go pick Sally's plan. Well, here's where the mistake comes in. There's probably not a single one of you today that are sitting watching me that are taking the same exact medicines as everybody else on the workshop. The other thing is you all don't go to the same doctor. You may even like different health networks and different hospitals, and you probably don't have family in the same place or travel to the same place for vacations. So your friend Sally, it turns out, never leaves Western Pennsylvania. In fact, she doesn't like to go more than 2 or 3 miles from her house. Her doctor's down the block, and she likes one particular healthcare network, which you don't like. So you get Sally's plan, and you go and try to use it, and the first thing you find out is your doctor doesn't participate. And then you go visit your grandkids in South Carolina, and guess what? You're not covered in South Carolina. So the plan that works great for Sally turns out not working so great for you. The moral here is you want to make sure that you figure out what's important to you and then select a plan that fills in all the gaps and checks off all the boxes on what you think is important. So if we're looking at this fork in the road now, so the blue side is when you're deciding to stick with original Medicare A and B, and you get a supplement or a gap plan to fill in what Medicare A and B does not pay for. Now, if you're still working and have some employer coverage, or maybe you have retiree group coverage, the first thing you have to do is check and see if they require you to have Medicare A and B. And most times these employee plans will have prescription drug coverage already right in there. If you don't have that option available, you're not working or don't have a retiree group coverage, then you can get a Medigap plan, and those go from letters A through N, and they do require you to have Part A and B in order to get a gap plan, and in order to have full coverage, you do have to get prescription drug coverage as well separately. On the other side of taking the other fork in the road, you're replacing your original Medicare A and B with coverage offered by a private insurance company. Now, these private companies have entered into a contract with Medicare, and they're going to provide you care that's at least as good as standard Medicare A and B. So the one choice you have there is a regular Medicare Advantage plan. They also require you to have Medicare A and B. And what we see in our area is HMOs and PPOs. They will usually have prescription drugs included right in along those. Now, if you're one of those dual eligible people, that has both Medicare and Medicaid, they require you to have A and B as well, and those are going to be offered as HMO type plans. You know, and one of these is not better than another. What I like to say is, you know, everybody's situation is different, so there's pretty much you can choose something that works best for you between these two forks in the road. You just want to make sure you're not heading down the wrong one right from the very beginning, though. Makes it a little bit tougher. So we're going to go into our Medigap insurance, and if you have something there to write with, a pencil and paper, here's something I want you to write down and underline. Okay, so right now in Western Pennsylvania, we have 60 carriers that are offering these plans A through N, but we do have 60 carriers offering Plan G, and that's the most that we see with any single type of those insurance. So with those carriers offering Plan G, so here's the thing, Plan G, Plan A, Plan B, it doesn't matter. They're offered under strict guidelines that Medicare makes up. So each company's Plan G is going to be identical to each other's company's Plan G as well. So again, all the coverage offered by each of the Medigap carriers, whether the plan is A or G or N, is going to be identical. Okay, those plans are available in 47 states. They're not available in Minnesota, Wisconsin, Massachusetts. Since we're not broadcasting our webinar there, we're not really going to go over that in too great a detail. Now, everybody that's getting stuff in the mail is going to be seeing this chart next, okay? And it is what those Medigap plans letters, what they cover. So each one of these boxes going across, if you remember at the beginning where we said that there were Medicare pays all but, the gaps in Medicare. So each one of these blocks represents something Medicare doesn't pay for. So if you want to have the most comprehensive coverage, you want to look for the box that has the most check marks in it. So the one right now that's offered in 2020 that has the most check marks, Plan G, and the only thing it doesn't pay for is your Medicare Part B deductible, which is $198 in 2020. So you're going to see this chart in almost everything you get, and this is really all it breaks down to. The less boxes you have checked, the more things you have to pay for when you need coverage. So let's jump over to the other fork in the road now, the Medicare Advantage. And again, this is where a private insurance company is going to be taking over the responsibility for providing your medical care. In Allegheny counties, we have 7 carriers and 41 different plans. Butler, Westmoreland, with the same 7 insurance carriers, but one more plan that's a plan specific for each of those counties. The Medicare Advantage plans, there is an election period when you can get into one of these plans, and so you can only join these Medicare Advantage plans at certain times of the year. So the first time you can get a Medicare Advantage plan is during your initial enrollment period. It's the same as your enrollment period for Medicare, those 3 months on either side of your 65th birthday. There's also another time where you can change your Medicare Advantage plan, get into a Medicare Advantage plan, or come over from regular Medicare and do this. And that's that time of year where every single commercial on television is about some kind of Medicare health plan. That's October 15th to December 7th. Now, if you make a change or enroll during this period of time, your coverage starts January 1st. And then there's one other period of time where you can get into a Medicare Advantage plan. We kind of call it a do-over. This is a new thing for 2020. So say you listen to Sally and pick the plan that you like or that she likes, and you go to your doctor on January 3rd and he doesn't take your plan. Well, during this period of time of January 1st through March 31st, you can make one switch with your Medicare Advantage plan. And pick a new plan. You can also decide you don't like Medicare Advantage and go back to original Medicare A and B. Or you can switch from one plan to the other. Now, here's the thing, though. If you want to go back to original Medicare, you also have to or should get a GAP plan. Now, when you first sign up for a GAP plan, there's a 12-month period there where they can't ask you any health questions. But after that period is over, the GAP plans, if you want to go that route and get that kind of coverage, they can ask health questions and say, no, we don't want to have you as a client with the plan. They can deny you enrollment. So you have to be a little bit strategic with that. With these Advantage plans, there's no health questions. As long as you're in a valid election period, you can switch plans. Now, here's something else. If you move from the area, okay, so those plans I told you about are only offered here in Allegheny County. There's 41 plans, 42 plans. These plans are only offered in certain areas. So if you move from Western Pennsylvania, you have an opportunity to get a plan that works in your new area, and you'll be in a special election period. And sometimes, and it's not very common, but it does happen, sometimes an insurance company will say, we're not offering your plan anymore. They'll do it in the middle of the year, so you'll lose coverage through no fault of your own. And during that period of time, you're allowed to pick a new plan without any kind of penalty. So here's the other thing, people want to compare. Okay, so, we're going to put the two side by side so we can help you figure out, what maybe fills in all of the check boxes for you. So Medicare and a Medigap Plan G, and we're going to talk about Plan G because it's by far the most popular here in our area. So the thing that people look at when they choose this side of the path is they like the fact that any doctor, any hospital in the U.S. that takes Medicare will accept their plan, so they can have free travel and know that there's no restrictions. With the Advantage plans, people know that there's doctors and hospitals that are in a particular network. Now, if you get an HMO Advantage plan, you do have to stick in that network if you want to have coverage. If you get a PPO, they will let you go outside of the network as long as you agree to pay extra. So the Medigap supplement plan is there's no copays. So people like that fact. So they can go to the doctor and there's nothing that they have to pay to go to those doctors. On the other side, the Advantage side, they are copay shared expense plans. So as you use the doctor, use the services, you will pay a little bit each time you go. With the Medicare and the Medigap, you do have to pay the Part B deductible. This year, it's $198. And with the Advantage plan, most of the plans are $0 deductible. So you can start having coverage and payment for your health services right away from your first service. The Medicare supplement with the Medicare is there's no out-of-pocket expense. And again, we're talking about Plan G. And with the Advantage plans, there are out-of-pocket. And those out-of-pocket will vary by the plans. They're all shared expense plans, so the more that you use them, the more that you're going to have to share those expenses. And with the Medicare and Medigap route, you will have to add prescription drug coverage in order to have the most complete coverage there. Okay, and the Advantage side, those usually have the prescription drugs rolled right into them. So what are the popular reasons that people like the Medicare, the Medigap route? Is the big thing is the freedom of choice. They know that they don't have to worry about which doctor they go to. They don't like, maybe having to stay within a specific network. They know that there's no copays and no referrals required. So really freedom of choice, and they know that they're going to be able to budget their healthcare expenses right at the beginning of the year. On the Advantage side, the most popular reasons people to select those is there's lower monthly premiums, okay? And there are, in fact, $0 premiums out there, and they are shared expense plans. They may already like the network where their doctors and hospitals already are part of that Advantage plan. They like the fact that prescription drug benefits are included, and because of that, it makes it simpler. Now, again, one side is not more right than the other, but some people have different things that they feel are important. So, and sometimes we see in a household, a wife will have a Medicare and a Medigap plan, and the husband will have Medicare Advantage. So again, there's no right or wrong or better or worse. What fits your situation the best. So again, you're going to have a lot of choices when you get your Medicare coverage to fill in the gaps that what Medicare doesn't pay for. So you're going to have a choice of an unbiased advisor versus going right to an insurance company or an agent that works only for a single carrier. So again, and this comes down to discovering what's most important to you and getting the plan that's most closely customized to your needs. So the unbiased advisor is going to work with all the Medigap, the Medicare Advantage, and prescription drug plans in a particular area. Whereas the insurance company is only going to know about the plans they offer. So, I mean, you call an insurance company to talk to them about their plans, they should be the expert in their plans, but they are only going to have limited choices. The unbiased advisor should be an expert in all the plans offered in their area. Okay, so the unbiased advisor is going to find out what's important to you and figure out what your needs are, what you want in your health care plan. Whereas going straight to a particular insurance company, they're, again, going to tell you what they have to offer and how close they can come, which of their plans comes closest to filling in all of your needs, even though it may not cover all of them. The unbiased advisor is going to come up with a personal coverage plan and list several options from within all the carriers that they have available to them. Again, the insurance company, is going to only show you a choice of the plans that are offered by that company. Options and choices will be available. With the unbiased advisor, you can do what if. So what if I decide I'm not going to travel? What's going to work best for me? What happens if I am going to travel? And then with the private insurance company, there's going to be no comparisons, and they're not going to share what plans their competitors have out there that may work better for your situation. I always like to say this is like when you're car shopping or maybe truck shopping, and you're going out to buy a new pickup truck. And if you walk into a Ford dealership, they're going to tell you everything about their F-150 and try to sell you on its benefits and how it works best for you. But that one thing that may really be the most important thing to you may be something that's over at the Dodge dealership, or that lift gate that they have with GMC that goes 6 different ways. And the Ford guy is not going to tell you about that. So again, you need to have an unbiased presentation of all your options. The unbiased advisor should be providing you annual personalized follow-up, because the one thing I do know is everybody's health changes from year to year. And even if your health doesn't change, sometimes the makeup of these plans change that could have a big effect on where you go, receive your health care, and what you end up paying for it. And the insurance company, the only thing they're going to do is send you an update of how the plan you already have is either going to stay the same or change for the upcoming year. The other choice you're going to have is working with a local advisor as compared to working with somebody who's far away. And most of the time when you're going on the internet, doing a search or filling out a card and a piece of mail that you received, that's going to have somebody that's not in Western Pennsylvania call you and try to get you to use their services. So again, what's the difference here? And again, looking at websites, I always like to throw this piece of advice out there. If it has .gov at the end, it's going to be an official website. It's going to have the best information for you. If it has something else, it's probably not official there. So again, so the local advisor, and again, I'm comparing what we do to what other people do, is we know the local market. We know everything that's been going on here in Western Pennsylvania for years. We know what's going on over the last 5 years where we had, two carriers butting heads. And we also know how the local clients here, what their experiences are with each one of those insurance companies. Whereas that a guy that's sitting in Florida or Utah that's calling you on the phone, he's going to have a limited knowledge of any market because he sells plans in many states. There's more than 7,000 of those Medicare Advantage plans out there, and to keep straight what works best in each area is almost impossible. They're also not going to know what clients in Western Pennsylvania like. Local advisor, we're going to have access to all plans and all companies' information, so we can offer coverage with any company that sells in the local market. Whereas the advisor that's out of state, he may only have access to a few companies. We'll tell you about the choices that they have to offer. They're going to, local advisor, going to show you ideas for all the plans. He's going to show you all the options of what could work best for your situation. And again, there's not any incentive to offer one insurance carrier's plan over another. Whereas that distant advisor, there may be an incentive to not mention certain carriers, again, because of what they have available to them. Okay, and the other thing that's important is you can find us. I mean, up until about 6 weeks ago, we were at a local library, probably in your neighborhood, doing these workshops and services, and you can come visit us. A lot of times, people have questions. They come right to our office. We'll sit down and have coffee with them. And if you can't make it to our office, and we're right here in the North Hills, is one of our advisors, and we have advisors all across, the area here in Western Pennsylvania. They can come right to you and help you figure out your situation. And that guy that's calling on the phone, well, the thing is, I always say, where the heck are they? They may be located thousands of miles away and have turnover with their advisors all the time. The other thing local advisor does is annual personalized follow-up. To see how your situation has changed, and they're also going to know all the changes with the local carriers. And the distant advisor probably not going to have any follow-up whatsoever there. So again, what's the bottom line? This comes into what's going to be the best for my situation. Well, if we're comparing the Medicare supplement with original Medicare to the Medicare Advantage plans, so they both require you to have Medicare Part A. Okay, so it's a $0 cost there. You've paid through it, or your spouse has paid through it all through their life and their working years. Okay, they both require you to have Medicare Part B. And for a whole lot of people, the Medicare Part B costs $144.66 or 60 cents each month. Now, there are surcharges if you have higher income levels, and we're not going to get into that right here just because of the time. But if you're interested to know what those income levels are to face a surcharge, just put your name over there in the comments, type surcharge by it, in the chat, and we'll make sure we get you that listing of what those surcharges are, that surcharge chart. So again, regardless, that number is going to be the same whether you have Medicare Supplement, Medicare Advantage. Okay. So again, we've been talking about Plan G all day. What does Plan G cost? Well, in our area, it ranges from around $90 a month to over $300 a month. And if you remember what I told you to write down earlier and underline, if we're talking about a Plan G, the benefits are going to be identical regardless of whether you buy the $90 plan or the plan that costs over $300. So why would you get a plan for $300 when there's a $99 plan out there? Okay. So you probably shouldn't. Again, that comes from having all the information available to you when you make this decision. On the Advantage side, We have lots of plans with low or no monthly premium. There are $0 plans out there that have excellent benefits. And the benefits there also go up to beyond $300 as well. And with the Advantage plans, this is not one of those situations where paying more money gets you better coverage. There are some plans out there that have far lower premiums that have better benefits and better coverage than a plan that costs more than $300. And again, the only reason somebody selects that $300 plan is they didn't know about the plan out there that costs $48 a month. Okay. On the Medicare, Medigap side, you will have your $198 deductible to pay. It's not there on the Advantage side. You will have your Part D monthly premium to pay, and that could go from as low as $13.20 a month to over $100. On the Advantage side, the Part D is included. There's no extra premium there. So if you're one of these people that likes to budget and know what their out-of-pocket is going to be each month, Medicare or Medigap plan is pretty easy to figure out. You have your Medicare Part B premium every month, your Medigap premium, your Part D premium, and any drug costs. And that's going to be your medical expenses and your budget for each month throughout the year. On the Advantage side, it's a little bit tougher. Okay, it's going to depend on your doctor copays, how much you use, the hospital services, but the one constant we know on that side is your medications are probably going to be the same throughout the year unless something bad happens. So on that side, we kind of try to pick plans based on what your medication costs are. And again, there's not one of these that's better than the other. The Advantage is not better than Medicare and Supplement. It's, again, what's most important to you, what makes you most comfortable when you're picking this coverage and gives you the most peace of mind. That's really the only deciding factor right there. So we said earlier that you do not want to face a penalty. So in order to not come up with that penalty, we talk about when is the right time to enroll in Medicare. We have three situations that determine this. So one is if you're still working and have coverage through your employer or group insurance. Another situation is if you're already collecting Social Security. And the final is if you're not collecting Social Security. So if you're still working and you still have coverage under your employer, okay? So what we always used to say about 2 years and previous to that, for most people, it made sense to stay with their employer's coverage. Now, what we've seen happen, especially since the beginning of this year, the employers are asking you to share more of the cost with the health insurance coverage. So more is coming out of your paycheck each month to provide for the health insurance. The other thing that we're seeing is the deductibles are creeping or getting higher and higher. We're even seeing some people that have selected high deductible plans that have a $5,000 deductible. So if those people that have selected the high deductible plan, that means they're paying the first $5,000 out of pocket before the insurance company pays anything on top of what's coming out of their paycheck. So if it looks like your employer plan is going to be better for you, you can delay enrollment in Medicare Part B and have no penalty, no loss of options. You're good to go. But if once you sit down and look at the cost of your employer coverage and compare it to the cost of Medicare, it may be in your best interest to come off. Now, we've seen some people, again, I said, and this is happening more and more this year, where it costs them $600 less a month to come off the employer coverage and take benefits with Medicare and an Advantage plan, and they still get coverage on the marketplace for their spouse, and they save $600 a month and had coverage that was better and started paying right away. So if that's your situation, then you can leave your employee group insurance, can enroll in Medicare and select either a Medigap or a Medicare Advantage plan. Now, the thing you always have to look at here is what if you have a spouse that's younger than you, if you have some dependents at home, what is going to be their options for health insurance coverage? Because a lot of times when the employee leaves, they can't keep their spouse or beneficiaries on. So you got to look at them as well, and what's it going to cost to get them coverage if you come off. And most times too, if you leave the employer coverage, they don't let you come back. So what happens if you're already collecting Social Security? And this is probably the easiest situation of collecting Social Security already. So what happens if you're already collecting Social Security? The enrollment in Medicare Part A and Part B is automatic. We used to see this all the time with people taking Social Security at 62, 65. Medicare sent them their Medicare A and B card about 3 months before their 65th birthday. Okay, and then they have a choice. If they have retiree group coverage, they can select that, and as long as that coverage is credible and doesn't require Part B, they can delay enrollment. But again, you kind of have to do this cost analysis here. Is it going to cost me less to keep the retiree coverage or less to go on Medicare? If it's going to cost less for Medicare, then you can select your Medigap or your Medicare Advantage plan. And this is what we're seeing more and more often. We're seeing people not collecting Social Security at age 65. Well, what we're seeing them do is, wanting to wait until they can reach full retirement age and get a bigger Social Security benefit. So what we're recommending now, and this is truly the easiest, this did not always used to be this way, it's to visit the Social Security website. And you want to do that 90 days before the month that you turn 65. And that website is www.ssa.gov. Okay. The reason we recommend it because it really is an easy process. But if you're not comfortable with that, going and doing it through the website, we're glad to help you with that. Now, some people that weren't comfortable going to the Medicare website, we'd tell them to make an appointment at Social Security office, their local office, and talk to a representative there directly. However, with everything that's going on right now, that option is not available. You're going to be talking to somebody on the phone. Now, here's why that's not really as helpful as going right to the SSA website is because you have to print the final screen to verify that you've done what you're supposed to do at the right time. They're going to give you the option to print that page. It's called your reentry number, and that is your verification that you've done everything with Medicare exactly when you're supposed to. Because if you don't have that verification number, you have no proof that you did that. And if you remember that person we talked about that went 11 years without their Medicare Part B, they had done an in-person enrollment at a Social Security office, not here in Pennsylvania, it was out of state, but that person that working in the Social Security office didn't do everything they were supposed to, didn't enroll them in Part B at the right time. They had no proof to verify they did what they were supposed to, so they paying 110% penalty for life. So if you have that page, it's very easy to fix any mistakes. Without the verification that you've enrolled, it's very difficult. And then once you've enrolled in Medicare, you can either keep your employer coverage, your retiree group coverage, or enroll in a Medigap versus Medicare Advantage plan. So these are some useful websites. Okay, first one of those again is that Medicare.gov. Second one of those is mysocialsecurity.gov, and this is a really good website because it's going to have your Social Security, your earnings history for them there. It's going to have when you claimed and filed for benefits, and the stuff here is really useful. And another site that's really useful is mymedicare.gov. And as far as your medical goes, this is probably the most useful one because once you set up your MyMedicare account, you'll be able to go in there and see who your doctors were, when your doctor's visits were, what medications you're taking. And if you happen to not write it down, if you happen to forget at a crucial time, this is available out there for your other providers. So that it is good to set up a MyMedicare account there. So who here remembers this guy? Okay, standing there at the beginning of the maze. You know there's an end. You know there's some twists and turns out there. Well, hopefully because of today's workshop, you're more confident that you can make it to the end point of this maze a little bit easier, but you may not be entirely confident that you are not going to avoid all the dead ends and backtracking and maybe doing some extra work to get to the end point. So here's what we're hoping to get you to is this happy couple here. They're smiling there at the end of the maze. They've crossed the finish line, and we like to joke that they're there because we have a map. We have a map to the Medicare maze, and we help to guide them through that. And here's the thing that we do, whether we're doing a workshop in person with you, or doing one of these virtual Medicare workshops, is we offer everybody that attends a Medicare done for you appointment that's no cost and free, and kind of provides you the map that will get you through the maze. Okay, some advantages of Pittsburgh Medicare One, what we do, how we do things differently. Well, here's the nice thing, is we're just not some guys here in Pittsburgh. We're part of a much larger company. We have over 800 advisors nationwide. We have offices in over 40 cities, and our parent company has developed this great exclusive technology for us. And I've not seen anything like it anywhere. Now, back in the old days when we tried to help people select Medicare plans, we kind of had to do what you did, which was call all the different insurance companies, lay all the books out in front of us, and try to see which doctors participated where, which medications worked, all that kind of stuff. But we don't have to do that anymore. We pretty much enter that information in the computer. It's like I go to Dr. Smith down at McGee's Hospital, and I go to my PCP in the South Hills, and I like to go to Giant Eagle's, my drugstore, and these are my medications. And we put all those things in our computer, and we get a printout back like this, or a screen like this. And if you can see, there's little green dots there by the plan. That means that all of your doctors participate in that plan in the office you go to. Now, here's the other thing. If you try to do this research yourself, or you call each individual insurance company, something that's odd that we've come across time and time again is a doctor may practice in 4 offices, but they only accept this one plan in 2 of those offices. And those 2 offices may be nowhere close to where you live. Well, here's the downside of that. You call the insurance company, they don't know where you live, and they don't know if that office is close to you. You call your local doctor's office and get one of their front desk people or their back office people that administer this stuff. They're overworked as heck with all this kind of stuff, and they don't really know between all of the 41 or 42 Advantage plans which their doctor participates in, let alone all the different private health insurance and group health insurance options out there. They don't know. Well, this tells us if your doctor participates in your office. The other thing that it tells us is what your medication costs will be, as long as your medication does not change throughout the year. And it's like, again, as far as I know, we're the only people that have this. The other thing we have is we can go in and look at each of the insurance companies out there, all 60 of the Medigap plans, all 41 or 42 of the Advantage plans. And, so somebody that works for this one company may tell you that, hey, this is a good plan at $138. Well, here's the thing. We can go in and look at, they have only 5 people enrolled in the Commonwealth of Pennsylvania, okay? So here's the thing with these plans. The more people that are enrolled, the more price stability that you're going to enjoy if you sign up with one of those plans. Because if something bad happens to those 5 people, the premiums are going to go up for everybody. The other thing we can look at is the premium increase history. So this plan that you just got for $138, well, guess what? You're going to have an 8% premium increase on top of that, because they just started that premium increase March of 2020. Like the other plan on top, we can see their premium increase history the last 5-6 years. So again, we're going to recommend a plan that has a lot of insureds and has a good history of no rate increases. So again, a little bit more how we do things different. We're going to present all choices. We represent all the companies. So we're unbiased. We don't really care who you go with. The important thing to us is that you're happy with the choice, because we know that you probably have a spouse that's the same age or younger than you. We want to help them too, and we want you to tell people what a good job we did for you, and you share what we do with the people you know. Well, that Medicare Done For You appointment, where we go through and find out your doctors and where you like to travel and your medications, it's going to cost you nothing, okay? So it's $0, and I want to emphasize it's 0. In case you can't tell, we're kind of geeks about about this kind of stuff. We really get into this and know the information about this. And one of our guys here just turned 65. So he's looking at all these webinars, the same as you are today. And I was shocked. I mean, I was really knocked my socks off to find out that there are some advisors out there charging $500 for the Medicare Done For You service, okay? And that's not $500 per household. If both husband and wife are turning 65 at the same time, they're getting charged per person with a household discount. The other thing that they're doing is they're charging each year for that review, that free review that we do to make sure that you're on the correct plan. So the question we always get asked, everybody wants to know whether we're in one of the libraries around here. One of the questions that always gets typed in the chat bar there is, why does it cost zero? I mean, we have to get paid somehow. Well, here's the thing. Since we represent all the carriers, and again, we don't care who you go with, once we process your enrollment for that carrier through our office, then that XYZ insurance company pays us for the Medicare Done For You, because we're helping you get the best plan. We're making sure that you're going to understand that plan more fully, so it's easier for that insurance carrier. And we're also going to be like their first line of client service for you as well. So again, I hope you enjoyed this this Medicare 101 workshop. We're to the point where we're going to ask questions. If you just give me a second to get out of this here, we're going to stop the screen sharing and go to where you can type your questions into the question bar. So just give me a second to get over there, okay? Okay, so I have the question mode turned on, so please feel free to type your questions over there, and we're going to answer each one of those one to one, and we're going to let those come up. And the other thing that we're going to do here is people are going to say, well, how can we get in for this Medicare Done For You service? So we're going to have a link right up at the top of the page. It's going to be coming up right here in a second, and you can click that link and go right into your schedule. The other thing that we're going to do is we're going to put our contact number here on the screen so you can get in and have that as well. So okay, so the how to reach us is up there on the screen. You can go to our website, pittsburghmedicare101.com. Call us at 412-838-9654, or reach us at hello@pittsburghmedicare101.com. The other thing that I didn't mention is we have this 20-page guide, Navigating Medicare. And again, everybody that does a Medicare Done For You with us schedules one of those appointments is going to get this guide. It's going to take everything. It's in that 128-page Welcome to Medicare U book and put it here in 20 quick pages. So, okay, I can see questions starting to come in. So let's see. Excuse me while I read this here. So here's a good one. Okay, so this is from Cindy. So I'm still working. Is there a penalty if I don't sign up for Part B? So Cindy, that's a very good question there. As long as you have credible coverage through your employer, you are not going to have a penalty for signing up for Part B when you come off of your employer plan. What you do have to do is you can go to the Medicare site and get a form. You can contact us. We have a form that your employer's HR has to fill out, and then you have them fill out that you had credible coverage and send that off to Medicare along with your application to get your Part B started. Now, right now, with everything that's going on, they will accept faxes of that in, or you can mail that directly. I would just, for my own personal feel good about the application, is fax it so you have a confirmation. Okay, so again, so I have another question. How do we do all this for free? Again, we represent all the carriers. We're going to give you your best options, and when we sign you up with the carrier that you choose that's the best for you, again, that carrier is going to pay us for the Medicare Done For You service. Great question, okay? So how do I schedule an appointment with you right now, okay? So normally, if we were at a library, somebody come up, we'd schedule directly with them. We have a lot of people call into the office closer to the time that they turn 65, and we do the Medicare done for you then. Well, so you can still do that, and we'll do a virtual appointment just like you're here at the webinar today, and we'll share the screen. We'll show you the screens that we talked about there that show you all of your choices. We'll figure out what's best for you and present you your plan options. And we can most of the companies, we can sign you up with their online form with verbal signatures right on the spot if that's something that you want to do. The other thing is you may be turning 65 7 months from now, 4 months from now, 3 months from now. It doesn't matter. A lot of times we recommend is, get an idea of what's available for you, find out, what's going to work, what your plan is, because even though it may be 3 months off, 2 months off your decision, it's going to give you some peace of mind to know what your plan is. And you can throw all those books out right in the garbage can as soon as they come, all those envelopes, and ignore all the phone calls with peace of mind. So, okay, here's a good one. With a Medigap plan, can I go to any doctor I want? Yeah, you can go to any doctor that you want with Medigap plan as long as they take Medicare. And now here is the same thing with that. Now there are a very few doctors, probably less than 5%, that do not take Medicare. So like cosmetic surgeons for like non-injury or disease related, that's not going to be covered by Medicare. Pediatric doctors normally are not. So not somebody that most of you would be interested in using. The other few times we see doctors that offer concierge service where you have to pay a lot of money up front to have special treatment. I mean, you should always have special treatment from your doctor to begin with. I don't know why it would cost extra, but those doctors are most likely not going to participate in Medicare as well. Okay, so I have a question from Ken. So COBRA, okay, we have a question there of COBRA coverage. Okay, so here's the thing, what we normally see there with the COBRA, a lot of times it is expensive, because with the COBRA coverage is you are now not getting the cost sharing from your employer. So with the COBRA coverage, a lot of times it's less expensive to go on Medicare. And I'm going to jump back to the Q&A. I hope you've all seen the, because I'm having trouble with the questions coming up. Okay, so that's a good question there. Okay, so again, the COBRA coverage, the thing that you have to make sure there with that, again, is if it's not too expensive for you, you want to make sure that they do not require you to take Part B, because if you take Part B during the COBRA coverage, when you come off of it, you're going to lose your open enrollment eligibility with all the Medigap plans if that's the route you want to go. Okay, so again, I'm sorry I skipped away from Ken's question. So Ken has a question. Can you help me sign up for Part B of Medicare? Yeah, absolutely. We do that all the time, sometimes 4 and 5 times a week. People just are not totally comfortable with navigating to that through the Social Security site, getting into the Medicare. So again, we can help you with that. We'll do the same thing. If you're here in the office, we can do the screen sharing. We can do that with you. If we have to do it virtually, same thing. We'll do the screen. You'll see exactly everything we're doing as we're doing it. Let's see, a couple other things here. So what makes us different than everybody else that's advertising? Again, the two things I think are most important is we work with all 42 of those Medicare Advantage plans, 41 if you're in Allegheny County. We work with all 60 of the Medigap plans. We don't really care which one you pick. I mean, you can say, I want this, and we'll pull that application out. Or you change your mind, we'll pull out another one. It doesn't matter. A lot of times people are not going to have all of those plans available. They might only have 5, 6, 10, a handful here, there. You're not going to have all of that there. The other thing is nobody, and I could say nobody that I've seen has these tools available that we have, that our parent company has developed for us, that brings all the information together and puts it right there at our fingertips, and we share it with you as well, so you can see exactly what we're looking at, why we're recommending plan A or plan number 1 over plan number 12. How do I figure out if my doctors participate? That's a great question. It's very difficult, okay? I mean, if you want to try to do this on your own, you can call the insurance company, the plan you're looking at. See if if your doctor participates in the office you want to go to. If they don't have the answer, you can try your doctor's office. Maybe they'll have the correct answer. But again, we have our software will tell us which doctors participate in which office. So do we have any other questions here? Anything else? Okay, I'm not seeing, so I'm kind of going to count this down like an auctioneer to get your last question in. If you have a question, post it here in the question and answer. If you don't want to post it here in front of everybody that's in the workshop, then please feel free to shoot us an email, call us. If you think of a question later on, that's fine. And here's the other thing we're going to do as well. We're running another one of these workshops again on Wednesday. What we're going to do once we're done with that workshop is we're recording this, and we're going to make the best one of those recordings available to you. We're going to email that directly to you so you can have it, go over and look at it. That may prompt some more questions for you. And also at that time, that will give you, we're going to give you how to get in touch with us again there. So I'm going to say going once, going twice, and if there's no more questions, I'm going to invite you to go outside and enjoy the sunshine. Thank you for attending Pittsburgh Medicare 101, Medicare Made Easy, and hope you all have a good day and stay well. Thank you. Okay, hold on. I'm not going to quite end it. 65th birthday in June. Sorry, Jeff. I'm not going to quite end it. I didn't quite see that. So right now, I mean, so I almost would say if you were in one of our workshops, we joke your hair's on fire. You need to get a choice made, whether it's here with us or somebody else, and we're more than happy to let you schedule that visit with us. Okay, so we have somebody else typing. I guess I was closing down the bidding too soon there because, hey, thank you, Janice. I'm glad you found it informative. We really appreciate that. And again, if you have some thoughts, if you want to shoot us something you would like to have seen in this workshop, something we didn't cover, just again, shoot us an email, give us a phone call. Thank you so much again. Okay, somebody else is typing here, so we're going to give that another second. I guess I type a little bit faster. I'm assuming maybe some people are doing this on their iPad or their tablet. So, okay, thanks. Okay, okay, that looks like the end of the questions. Again, thank you so much, everybody. Have a good rest of the day.